presentation. So first of all, I thank you very much for this opportunity to attend the 79th annual conference for the All India Ophthalmologic Society. I do know that this is a very, very prestigious and well-attended meeting, and it's one of the most recognized meetings in the world, actually. And we're all very sad on behalf of the American Academy of Pediatric Ophthalmology and Society that we cannot be there in person. But hopefully in 2022, we could be there in person and share great camaraderies. My topic is on abusive head trauma. It's not specifically abusive head trauma, it's about ocular traumas, but I want to thank my co-investigators first. We have a case here, a 7-month-old child that came in, had a fever, vomiting overnight, and started having some seizures, and CPR was initiated and then was brought to the emergency room. And patient had a retinal findings like this. And then a day later, unfortunately, the baby expired, passed away. Of course, in situations like this, we go through extensive differential diagnosis before we come up with the diagnosis of possible shaken baby syndrome or abusive head trauma. So I just did a little bit of history. The first case of abusive head trauma was actually reported in 1868. And since then, there were some few anecdotal reports, and it actually went through many different names over the years. Starting with battered infants, now we're using abusive head trauma, but soon I think that may actually change. How big is this problem? It is the single most common cause of traumatic death in children under the age of 1. And the impact of COVID-19 is still not known, but some speculate that there's probably a significant underreporting. So this is a big concern. And unfortunately, the 80% of the survivors also have a permanent sequelae in forms of motor, intellectual, visual deficits. So it is a big problem, even for the babies that survive. Today, the shaken baby syndrome is actually still one of the most common cause of death. Even today, it's one of the most common cause of death in children under the age of 2. Why is that? Well, possible causes include a lack of awareness and doubt. If you don't have to look very far, just going to your computer or your phone and type in abusive head trauma. There's many articles out there by reputable, so-called reputable journals, the Anchorman, and actually there's even a movie that's made of that doubts the existence of abusive head trauma. And also our researchers actually have published numerous papers on how it is impossible to generate enough force to cause retinal hemorrhage with shaking in humans. And because of this, this actually was a big concern of mine. And even today, there's a cultural barriers and lack of reports on shaken baby syndrome. As a matter of fact, many parts of the world, we don't really have abusive head trauma reports in peer-reviewed journals in many countries. We actually understand what goes on in the brain, with the brain shifting back and forth with the coup and counter coup, but we really don't have a clear understanding what actually happens in the retina. Why 90% of the patients with this condition develop retinal hemorrhage? And it's not just a simple retinal hemorrhage, but this retinal hemorrhage actually occurs throughout the entire retina in the pre and intra and subretinal areas. And as we all know, there aren't too many conditions that can actually cause that. And on top of that, the retinal hemorrhage is not localized to the posterior pole, but its entire periphery. And why is that? Possible theories include increase in intracranial pressures, but the more likely that the theory is that there's a significant vitreoretinal traction. What does that mean? Well, here's an eyeball with the gel that's inside, As this gel is sliding back and forth, it can actually cause traction and resulting shearing force. But and OCTs on some of these cases actually have nicely shown a focal vitreoretinal traction with the PVD associated with the preretinal hemorrhages, along with the retinal schisis, as you can see. But it is not a simple translational force. It's not a simple shearing force. Here's an hourglass with the oil on top, water on the bottom. As you can see, when you're shaking this hourglass tangential to the interface, the interface is not going to be disrupted. But as I've told you, the intraretinal hemorrhage is actually the entire retina. It's not just in the posterior pole. It's not just localized to one quadrant, but it's entire retina. And that's probably because of this torsional component. What does that mean? Just with a simple, gentle torsion, you can actually disrupt the interface very easily. So it is not just a translational, but that torsional component plays a very important role. So the big question is, I get asked by the lawyers, how much is that force? Is that like a car? Is that a force that's consistent with a car accident? Is that consistent with just you wearing being in a car seat with a belt, like just with a simple vibration? Is that enough? What is that force? So my objective was to determine that force, and I wanted to find. My goal of my research was that I wanted to determine various forces at the vitreoretinal traction that's produced during forcible shaking. So how much force is being created by a shaking a child? And second, I wanted to determine how much force is required to separate the vitreous from the retina. So is shaking by simply how hard do you have to shake a child to cause the vitreoretinal separation that is resulting in the tearing of the blood vessels, resulting in retinal hemorrhage. And also, why does it cause those unique patterns of retinal hemorrhage? And so that's what I wanted to find out. So first, we created a very sophisticated computer simulation model using a finite element. And then also we used various animal models similar to human to determine that vitreoretinal adhesions. So first here, as you can see, we created a computer's finite element that would incorporate all the properties and characteristics of various tissues in the eye. And then we also added a vitreoretinal attachment point along the retinal vessels, posterior pole, and also in the periphery, similar to human. And then we looked at over 300,000 different small points within the retina at any given point. And then we divided the retina into thirds, the preretinal, intraretinal, subretinal. And we wanted to shake this eyeball similar to a baby doll model that was actually created by Yamazaki years ago. And he actually, what they did was that they put a accelerometer in the eye and also in the perpetrator's hand, and they shook this baby. And what they found was that it was this pattern. This is the position, exact position of the eye. So it's a figure of 8 in this fashion. So we shook this a finite element identical to this Yamazaki eye model, and we created this heat map. And then warmer the color, greater the force. And what we found was that the average stress along the vessel was about 7 kilopascal. And wherever there was a bifurcation, because there's a additional adhesion of the vitreous to the vessels, that force increased to 9 to 10 kilopascal. And then also we looked at the forces in various retinal layers, and we found that it was actually pretty similar in all 3 layers, and it was not statistically significant. So we compared this to a soccer ball injury. And so here's a force, here's a collision of the soccer ball. And then as you can see, this force is transmitted in a translational fashion, and there's really no torsional component. And what we found was that after that initial contact, that force declines dramatically. And also the subretinal and preretinal, the layers of the retina had statistically different amount of force that's experienced in comparison to the abusive head trauma. And we went to the animal model and we actually looked at the sheep. And there's a lot of reasons why we looked at the sheep. It actually had been well studied in the past. So we created a small opening in the sclera and then took out the RP layers and left the retina intact. And then this retina was glued to a plastic that we call PTFE and was glued with various materials. And we actually had ended up using polyurethane for various reasons. And then we placed it in a load cell and we gradually separated the plastic that's glued to the retina, and we gradually separated it, as you can see here. And we registered the force that's required to separate that vitreous from the retina, as you can see right there. So for this particular model, as you can see, that force was about 2.5 kilopascal. Here's the retina, and here's after the retina is taken out. And we confirmed it histologically. So the result was that the average stress was 2.72 kilopascal, and that number increased at different angles. So what we found, and we repeated it at different angles, and then we also repeated it with different animals. We used monkeys, and as you can see the force, and we found that the force was actually even less for young monkeys of 1.2 to 1.3 kilopascal. So what we found is that using our computer and animal models, we supported the hypothesis that shaking an eye at a frequency as low as 2.2 kilohertz can produce a stress level that exceeds the minimal threshold for producing vitreoretinal separation in young sheep and monkey eyes due to mechanical failure. And as you saw, that force actually increased over time. And that similar type of mechanical failure can easily occur in human eyes if the stress level exceeds the vitreoretinal adhesions. And also, wherever there was a bifurcation, it actually experienced a greater stress. So in peripheral retina, of course, there's a greater number of bifurcating vessels. This explains why there's a diffuse nature, the diffuse nature of the retinal hemorrhages in shaken baby syndromes. And also, the pre, intra, and subretinal layers experienced a similar stress level this actually explains why there's a significant retinal hemorrhages in all three layers. So in conclusion, our finite element can be used to recreate a trauma based on the history that's provided and calculate the force and the pressure applied to the retinal structures and correlate that with the clinical picture to see if they actually match. And if they do not match, and of course, we would need to pursue further and looking at the medical and social history investigations and the circumstances surrounding the traumatic event. Thank you very much for your time, and I'll be happy to answer any questions after our symposium. Thank you.
Thank you so much.